Good evening and welcome. I'm Vanessa Hoffman, Education and Research Manager at the Bladder Cancer Advocacy Network. Tonight we present Caring for the Cancer Caregiver. I'd like to do some quick housekeeping before we get started. You can listen to this webinar either through your phone or the speakers on your computer. You should see information for tech support on the left side of your screen if you have any technical issues. Please type any questions you have in the question box on the right side of your screen in the Citrix GoToWebinar panel. We'll try to get to as many questions as we have time for at the end of the webinar. Also, this webinar is being recorded and should be available on the Beacon YouTube channel within the next 2 weeks. I would like to introduce our distinguished speaker now. Dr. Allison Applebaum is a licensed clinical psychologist who specializes in helping patients with cancer and their caregivers. She uses a number of psychotherapeutic approaches and has expertise in using cognitive behavioral therapy to mitigate anxiety and depression and to improve overall quality of life in patients with cancer and their caregivers. She is director of the Caregivers Clinic at Memorial Sloan Counseling Center. She's also a member of the American Psychological Association, Society of Behavioral Medicine, and many other groups. She received her PhD from Boston University, her residency at New York Presbyterian Hospital, Weill Cornell Medical Center, and her fellowship at Memorial Sloan Kettering Cancer Center. I'm now going to turn over the mic to her.
Okay, thank you, Vanessa. Good evening, everyone. I'm so happy to be able to be joining you tonight and to be speaking about a very important topic, which is attending to the needs of caregivers of patients with cancer. As Vanessa said, I am a clinical psychologist, and I direct a program at Memorial Sloan Kettering Cancer Center, which is really a multidisciplinary program that has components of clinical care and research and teaching and outreach, but really my passion is with the clinic, the Caregivers Clinic, and providing services to caregivers of patients and caregivers who are distressed and burdened and dealing with the many challenges that they face as a result of the caregiving role. So this evening, what I'm going to do is just give you a little bit of background on what we know from the research about the experience of caregivers. I'm imagining many of you on this phone know from personal experience, and really then focus on ways in which we can identify caregiver burden and red flags, and then how to actually get care and resources regardless of where you are coming from. So to start, who are caregivers? I think it's important to differentiate because this term has been used so widely in the literature. Formal caregivers, many of us on this phone call may be formal caregivers. We are psychologists or psychiatrists or social workers or nurses, and we provide care for our patients and are ideally compensated financially to do so. Many of us may also concurrently be informal caregivers, which is the group I'm going to refer to and focus on this evening. These are family members and friends who are providing care for loved ones, but are not compensated for doing so, compensated financially. The World Health Organization estimates that approximately 8% of the global population is dependent on others for care, which is a pretty significant proportion. In 2009, so about 6 years ago, about 1/3 of households in the United States had an informal caregiver, and that translated into 65.7 million Americans, 4.6 million of whom provided care to patients for cancer, so very significant numbers. Informal caregivers are predominantly female, which is likely not surprising, and providing care to a parent. And importantly, over 1/3 of caregivers provide care to 2 or more people at one time. So the intensity of caregiving is usually quite great. Oftentimes I'm asked, what do caregivers do? And I usually respond sort of in a snarky way, well, with the answer of, well, what do caregivers not do? Since certainly caregivers are responsible for so much. But if we're going to be formal about it, on average, caregivers provide care for approximately 13.7 months, for at least a year, although 1/3 of caregivers provide care for 5 or more years, meaning that the duration of the responsibility is a long one. It's chronic. Recently, the annual economic value of caregiving in the United States was estimated at $375 billion. That means the efforts of informal caregivers across the country, those efforts translate into significant amounts of money. In terms of what caregivers do, they provide what we call technically instrumental support. That's help with activities of daily living, so basic self-care, helping loved ones to get dressed, use of medication, bathing, etc., transportation, and managing their care. But importantly, and sometimes overlooked, is the fact that part of the care involves emotional support and providing their loved one with support through their cancer trajectory. In terms of the caregiver experience in cancer, and in terms of time, this comes from, this is all from, mostly from 2009 and 2010 data, so a little bit outdated and new information is coming up, but the trends are pretty similar currently. While you'll see here in this pie chart, and I apologize the colors didn't come out as strikingly different as I'd hoped, while the majority or 41% of caregivers are only spending up to 8 hours a week, a very significant proportion, 23%, so nearly 1/4 of caregivers, are providing care for 40 or more hours a week. And often this is in addition to paid employment. So in many instances, caregivers are working full-time day jobs in addition to working full-time caregiving jobs. And you'll see a significant proportion, 23%, providing care for 9 to 20 hours and 21 to 40 hours. So a significant amount of time devoted by caregivers. Not surprisingly, as a result, emotional stress is quite common. As you'll see here, high stress is reported by 40% of caregivers, moderate 31%, and low stress by 29%. And I'm going to talk a little bit more about what we mean by emotional stress, but certainly this is not surprising in light of the magnitude of care. Across the caregiving trajectory, so at any point, and a caregiver is defined as a caregiver at any point in the trajectory from the time that their loved one's diagnosed, during treatment, during remission, during survivorship, during recurrence, perhaps during progression of disease, transition to end-of-life care, at all points in that trajectory, we know that caregivers, importantly, are a population at significant risk for psychiatric and medical morbidity. More plainly said, are risk for mental and medical illness. At the same time, caregivers are historically underserved, meaning they do not have services offered to them that are tailored to their own unique needs, and when they are available, don't use them, which is important for us to think about as a group. At the same time, what we also know from the literature is that caregivers are really interested in having services that attend to their own unique needs. Certainly there's interventions and support out there for families and for couples, but more rarely are services available for caregivers alone. And this is critical because what we know is that the majority of caregivers will at some point during that caregiving trajectory experience what we call caregiver burden. And what we mean by burden, and it's a word that's widely used in the literature, so I thought it would be helpful to put up an actual definition here. Caregiver strain and burden are used interchangeably. It encompasses the difficulties assuming and functioning in the caregiver role, as well as associated alterations in the caregiver's emotional and physical health that can occur when care demands exceed resources. Caregivers experience differing challenges during different phases of the cancer trajectory that can significantly impact their functioning and quality of life. Now, I put the second box down here because I think the most important piece of this definition is the demands exceed resources element. That burden occurs when the demands of caregiving exceed the resources of the caregiver. And this is usually unanimously across the board the fact that the resources of the caregiver are just not enough to meet the needs of the patient. So in terms of caregiver burden, this translates into what? It translates into physical problems. Most common are sleep impairment, insomnia, fatigue, and poor immune functioning is quite common, unfortunately. Many caregivers become ill themselves due to the stress of caregiving. There are social problems, certainly financial concerns, absenteeism, so missing work, and what we call presenteeism-related impairment, so going to work but actually not being emotionally present while you're at work and not being able to really fulfill the responsibilities you have while you're at your job, as well as role strain, having too many responsibilities at once, and then isolation, feeling very alone with the responsibility of caring. And then the emotional problems, which are widespread in terms of anxiety. This is a technical term which really encompasses many different constructs, which include worry, which means you're repeatedly thinking of the same thing over and over and over again. Fear, which is worry that is future-oriented, so fearing something in the future. Anxiety also often manifests as difficulty sleeping or insomnia, or somatic complaints. In my clinic, I usually tell my patients that you fall into one of two categories traditionally, that we either feel anxiety, what I say, above the neck or below the neck. So most often people either say, oh, I get headaches or sinus infections, my eyes hurt when I feel anxious, or patients report gastrointestinal problems, constipation, diarrhea, vomiting, that sort of thing. But anxiety very often presents itself in a physical way, and certainly, and I'm going to speak a little bit later on about red flags, but keeping track of how you're feeling physically is important. Depression is also quite common and involves feelings of hopelessness and helplessness. So hopelessness, having doubts about the future, feeling hopeless about the future. Helpless, meaning you feel a sense of inefficacy, which is very common among caregivers of patients with cancer. Sadness, loss of interest or pleasure, if you notice that you are no longer able to derive pleasure from activities that you once found pleasurable or interesting, if there's a shift there, that can be a sign or symptom of depression. Now, I bring up also existential concerns. A lot of the work here I do at Memorial Sloan Kettering Cancer Center is with families of patients with advanced cancers at end of life. And we talk a lot about what we call these big existential concerns that come up around end-of-life issues. And certainly, I have never met a patient with cancer or a caregiver who's not faced with and thought about and grappled with many of the existential questions that come up. But particular for caregivers are existential concerns around identity. Many caregivers report a feeling of losing touch with who they are, that the caregiving role begins to overwhelm their identity. Another existential concern is responsibility. The responsibility to take care of oneself oftentimes gets lost when the responsibility of caring for their loved one is great. And then guilt. Guilt is certainly an existential concern and likely the most common word that I hear in my clinic. I don't think there's one day that goes by where I see caregivers in my clinic where the word guilt hasn't been brought up at least once. And then, of course, there's the objective burden, which I referenced a little bit earlier on, but the direct care, directly providing care for the patient, whatever that means for your particular situation, indirect care, household tasks that then fall to caregivers as a result of the patient's limitations, significant impacts on caregivers' daily life, restrictions in their daily activities, their ability to plan for the future, their ability to be spontaneous, their ability to travel, etc., and changes in usual routine and lifestyle. And all of these elements contribute to what we call burden. So it really is this overarching term. What's really important to note, and I think is beginning to receive attention in the literature, the scientific literature on caregiving, is that most often, if not almost across the board, individuals are caregivers for long periods of time. Rarely are caregivers just caregivers for a week. It's more often months and years. And as a result, we must look at caregiving as a chronic stressor, just as we would look at other types of chronic stressors in the environment, that the caregiving role is a chronic stressor. And as a result, if we think about it as a chronic stressor, it's important to think about what are the impacts of this stressor on the well-being of caregivers over the long term. And so first, thinking about the impact on physiological health or medical well-being, just to give you a little bit from the literature, what we know from the literature is that caregivers who feel that they are burdened, who perceive a sense of strain, this is associated across the board with mortality, higher mortality among caregivers. This might be because they don't have time to take care of themselves or not attending to their own self-care due to guilt, or the demands are just too great. But what we know is that perceived caregiving strain is associated with all-cause mortality. We also know that current caregiving stress has significantly predicted hypertension, that there's a significant relationship between the stress of caregiving and hypertension, and particularly among women who, as I previously mentioned, make up the majority of caregivers of cancer patients. There's a relationship between caregiving and cardiovascular disease. So clearly a relationship between the stress of caregiving and these poor medical outcomes. I think what's important to note, and I mentioned that there's a beginning shift in the literature, is that there is growing recognition nationally and even internationally that when we think about providing care to patients with cancer, that across the board there's recognition that that care must include caregivers. And one piece of evidence I have for this is the inclusion of cancer caregivers in the definition from the National Cancer Institute from 2013 of cancer survivor. I look at this as a very significant step in our field in acknowledging that cancer caregivers are cancer survivors. So according to the NCI, or National Cancer Institute, an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. Family members, friends, and caregivers are also impacted by their survivorship experience and are therefore included in this definition. I look at this as a very positive step in acknowledging the critical role of caregivers and the fact that cancer caregivers are survivors too, and that when a patient with cancer becomes a survivor, that the issues for caregivers do not necessarily go away. In fact, they might remain and intensify. In fact, what we know is that during survivorship, caregivers are at greater risk for distress than patients. Very commonly, patients will experience a sense of relief. They can return in some ways to their normal life. But among caregivers, that's not always the case. In fact, what we find is that caregivers of long-term cancer survivors report significant health problems, including heart disease, hypertension, arthritis. They report lower quality of life, QOL, and receiving less support than do patients. And I think this last part I should have put in red, which I think is a really critical point, that patients who enter survivorship often report very strong social support networks in the research literature. But it's at this point that caregivers are actually saying, wait a minute, we're actually not receiving the support they need. So there is a significant discrepancy between the experience of patients and caregivers at the point of survivorship. Importantly, for survivors, there's among cancer survivors, certainly fear of recurrence is a common problem, but that fear of recurrence is often equal, if not greater, among caregivers than patients themselves. And certainly one can appreciate why that is, since the demands of caregiving become great when treatment is active and when there are concerns about recurrence. And certainly for caregivers of patients who are now survivors and maybe have taken time off from work or cut down their hours or shifted roles, navigating that return to full-time work, navigating that return to full-time family roles requires negotiation. It's not always simple. It's not always simple. I have patients say to me, you know, I was a full-time lawyer and a part-time dad and a part-time husband, and now I'm a part-time lawyer and I'm a full-time caregiver, and then going back to being a full-time lawyer and part-time dad, that was challenging for him. And certainly for each of us, that's unique and personal, but navigating those roles can be very complicated. Now, during survivorship, at the same time, caregivers are at greater risk for psychopathology than patients. Again, another fancy way of saying poor mental health. This is a study, a more recent study from 2012. It's one of the only studies, only longitudinal studies, that examine caregivers across a span of several years, so following them to see their levels of anxiety and depression over time. And what the authors found was that, not surprisingly from what I've previously said, that baseline levels of anxiety and depression were higher among caregivers than among patients. And that these symptoms remained stable over a 2-year survivorship period. They looked at 4 models. I'm not going to bother you with the specifics of the graph, but the symptoms remain stable over time. And levels of anxiety and depression really maintained consistency from 6 months to 5 years post-diagnosis. The main message here, which I think is really critical for all of us to hear, is that yes, we know naturally that levels of anxiety and depression are possibly higher among caregivers than patients, but that if we don't do anything about it, whether the healthcare professionals on the phone or on the line aren't doing anything about attending to the needs, or caregivers aren't asking for help, that the situation is going to get worse. The anxiety and depression will just not go away on their own, that we do need to intervene, and that these symptoms can become quite significant and distressing. In 2008, the Institute of Medicine, in their report, Retooling for an Aging America, Building the Healthcare Workforce, this report highlighted the responsibility of healthcare professionals to prepare caregivers for their role and the need to establish programs to assist them with managing their own stress that results from providing care. Now, I came to Sloan Kettering in 2009, 2010, so a little after the report was out, and I was very struck by the fact that in this very large institution, which has a very strong and thriving department of psychiatry, that there were very few targeted services for caregivers. And it was due to, in many ways, reading this report and taking a look at the literature out there, that it made it very clear to me that our hospital really did need a service such as the one that I've developed. And certainly, across the country, a gold standard would be for every comprehensive cancer center to have multidisciplinary clinics. That said, that's not a model that can be translated into every setting, and certainly one that is not accessible to everyone across the country, and we recognize that here. So I want to talk then more broadly about how you can get help, because I think what's clear is that caregivers are at risk for burden and strain. We know that, and we know that we need to do something, but a big part is how to get help. So to begin, I think the first piece is recognizing signs and symptoms of burden. And so what that means is that if you're a healthcare professional and you're coming into contact with caregivers, most likely in the context of a visit with a patient, that it's important to take note in your interaction with that caregiver about how they're doing. I certainly know from the report of my patients in my clinic who are caregivers that they really do like it when someone asks, how are you doing? And I'd encourage all of you on this call who are professionals to make a point to ask how caregivers are doing, and to recognize signs and symptoms of burden in caregivers so that you can ideally make appropriate referrals. I should go back. And then within yourself, for those individuals on the call who are caregivers, it's important for you to take a moment and think about, how am I doing? Objectively, how am I doing in terms of my sleep? How am I doing in terms of anxiety? Have you noticed, for example, significant changes in your appetite? Have you noticed significant changes in your weight? Have you noticed, for example, significant changes in your what we would call health-related behaviors? Are you drinking more than you used to? Are you not going to the gym as much as you used to? All of these things can be red flags and signs and symptoms of burden. And I'd encourage each of you on the phone who are caregivers to really take a moment to honestly reflect upon how you're doing. And certainly there are areas in which you're excelling, I'm sure, because you're on this call, but I'm sure there's always areas for improvement, and I want you each to think about what those areas might be for you. I know I can easily list some for myself at any given moment. It's also really critical to activate your support networks, which is not always easy to do, easier said than done, I understand, but critical. If I were to go back to my earlier slide on caregiver burden, what I emphasized was that caregiver burden occurs when the responsibilities outweigh the capacity of the caregiver. And no one caregiver can do this job alone. I have yet to meet a caregiver who can do this job alone and be okay. And so a network of support is needed. And certainly there are instances where many caregivers are involved, but if that's not the case, it's critical to activate support networks. And in order to do so, you really do need to challenge yourself to ask for help. I think one of the unspoken or less spoken about pieces here is that while generally speaking, caregivers are thrown into the responsibilities, there is always an element of choice in terms of the extent to which one participates in caregiving. And oftentimes they are individuals who are very self-sufficient and historically have not asked for help who become primary caregivers to individuals with cancer. And so it's oftentimes particularly challenging to ask for help because you're likely, many of you on this call may likely be people who've never asked for help before. And there may be many barriers to doing so, and it may feel uncomfortable. It may feel, maybe you think it's a sign of weakness, or maybe it's just you don't want to bother others. But I really do believe that it's important to challenge yourself, whatever those preconceived ideas are about what it would mean to ask for help. I encourage you all to ask for help. The worst that anyone can say is no. What I've learned is that asking sometimes leads to you being surprised. So I encourage you to activate your networks and ask for help. And in doing so, you may find that support may come from unlikely resources. You might have historically depended on family members or a particular group of friends for support, but perhaps there are other individuals in your community, perhaps coming from, let's say, faith communities, churches or synagogues or organizations in your community, or just colleagues at work who might be able to help. The idea being that I encourage you to be flexible in who you think about asking for help, and that support, when it comes, can be extraordinary. I think it's also really important to recognize what we mean by self-care, which is a phrase that's thrown around quite often in the caregiving literature. When I earlier before mentioned the word guilt as the most common word that comes up in my clinic, I link it to self-care. A day doesn't go by where a caregiver comes where no one comes in to say to me, I shouldn't be going to the gym. I should be with my husband. And what I would encourage you all who are listening right now to think about is when you feel guilty because you've taken time or you want to take time or you're thinking about taking time to do something for you, whether it means you're taking an afternoon or a day or a night or a weekend away, or time to go to therapy or time to go to the gym or time to chat with friends. If you feel guilt is really a red flag. And I like to reference it and refer to it as a call to care for oneself. When we feel guilty, we're usually saying we should be doing something for someone else. I feel guilty because I should be helping him. I shouldn't be here with my girlfriends. I should be home helping my husband. Instead, when you feel guilty, I want you to acknowledge that the person that you're letting down, it's not your husband or your parent or your child or your friend, it's yourself. I encourage you all to recognize that when you feel guilt, that is actually your body and mind's way of telling you that you're not taking care of yourself. Guilt is a strong red flag that self-care needs attention. And of course, I think it's important for me as a clinical psychologist and also as a human to mention that self-care includes expressing emotions. Self-care certainly includes care for the body, but it also means care for the soul. And that does include expressing how one feels. And I encourage you all who are caregivers to find people in your world, whether they're professionals or friends or lay people, and speak openly and honestly about what you're feeling. it can make the world of difference with your experience of caregiving. And I know that so often there are feelings of guilt that come up, and feelings of anger and frustration, and feelings that maybe you're embarrassed about speaking about. But expressing these emotions are quite important to the preservation of your mental well-being, so that you can continue on this very important journey. I thought I would end, since this is this is a webinar for all of you across the country, with some resources that can be accessed by all of you. And these are resources that I've directed my patients to historically, and they've found useful. So I hope that you find them useful as well. And I imagine that these slides are going to be available to you. So if you can't write very quickly, I'm sure you can receive a copy of them. But the first is the American Cancer Society. The ACS is a phenomenal resource for caregivers. I should say that over the past 3 years now, I've actually been working directly with the ACS to improve their resources for caregivers, their programming for caregivers. And you can find general information and support and referrals and guidance on services that may be available in your community, wherever you may be, via their website, thecancer.org. But I also do want to mention, because it wouldn't do justice to my work if I didn't, that I currently have a study that's up and running right now specifically for cancer caregivers across the country. And it's basically a web-based study. It's a webinar program that's very similar to the format of what we're all doing tonight. And it's free of charge. In fact, there's probably some payment for you all if you want to get involved as an extra source of support. And you can call the number 844-233-8958 or email our research staff here at Sloan Kettering Institute, which is SKI-CareStudy@mskcc.org. So this is a nationwide study of cancer caregivers. It's a support program, and it's all web-based. So I just wanted to give a little plug for that. But in general, the ACS is a phenomenal resource, as is Cancer Care. Cancer Care is also another resource that can help direct you to services in your community. Oftentimes, there are support groups for caregivers done either in person or virtually, like this one, through Cancer Care, as well as the Caregiver Action Network. I don't know if you all are familiar with this as well, but it's another organization, agency that focuses on caregivers. I believe it was born out of work with caregivers of patients with dementias, but certainly the services and the support it can generalize and attend to the needs of cancer caregivers. A few others are the Family Caregiver Alliance, the National Alliance for Caregiving, which is actually the organization from which much of this data was drawn. All of that data about the numbers of caregivers across the country, that all comes from the National Alliance for Caregiving, and Strength for Caregiving. So all of these websites and phone numbers can be helpful for you if you are looking for resources. What I want to say about resources is I like to think about resources both internal and external. So when you think about how to find help, I want you to think about your internal resources. What are your strengths? What are the strengths you have right now? You're taking care of yourself by being on the webinar tonight. Do you take care of yourself on a regular basis? Are you resourceful? Are you a problem solver? Do you ask questions? Think about your internal resources, and then think about the external resources you have. Who's in your caregiving network? Who's in your social support group? What is your employment situation like? And have you accessed any of the resources that are available to you across the country? So it's important to think about what is untapped as of now for you. I guess I want to just finish by just two important quotes. This comes from Vanessa and I met over the summer at the American Cancer Society's Survivorship Conference, and Rebecca Johnson, a physician, had said in one of her talks, marriage is just as effective as chemotherapy. And I really liked this. It really struck me, and it's stayed with me since June. And the fact is that we can give our patients all the chemotherapy in the world, all the radiation treatment, all the surgeries, and everything else that we have. But really, having a caregiver, having a loved one support patients through the journey is just as important, if not more so. And so all of you who are caregivers should be applauded and thanked over and again for the hard work that you do, because survivorship could not occur without you. And equally important is this fact: cancer caregivers are the next generation of cancer patients. I want to end with this because what's so critical about attending to self-care, what's so critical about attending to the needs of caregivers is the reality that if we don't, that all of you who are caregivers and burdened by the role are really at risk for poor physical outcomes. And so I hope that when you think about taking care of yourself, that this is on your radar as well, because certainly we don't want you all to become the next generation of patients. So I'm going to end with that, and I'm going to leave you with my email address, which is you're more than welcome to contact me at any time after this evening with questions or comments. I'm pretty responsive, and I'd be more than happy to hear from you and to speak further. I know that we have about 20 minutes or so for questions, but I'm sure that maybe there are thoughts that might pop into your head after this evening, and you're more than welcome to email them to me after tonight. So thank you so much for your time and attention.
Well, thank you so much, Allison. Let's see. So right now we have time for a few questions. For everybody who's joining, if you can type your questions into the question and answer box on your screen, we will get to as many as we can. For the first question, this one came in by email before the webinar, and the person wanted to know about what are the average costs associated with a family member providing care.
What are the costs associated with a family member providing care? Well, I don't have a direct answer to that question. You know, I did put up earlier some numbers in terms of the millions of dollars if we were to translate the effort of caregivers annually into paid care. I don't have that data specifically, but whoever did ask me that question, if you want to email it to me, I'm happy to direct you to one or two articles that might have that data for you. But in terms of the cost, certainly there are significant costs on families for providing care, and certainly the shift from inpatient to outpatient care has led to significant burden, financial burden for families. So again, I apologize for not having the exact numbers, but happy to find that information for whoever it was that asked that question.
Okay, thank you. For the next question, how much caregiver burden is okay, and is that okay?
That's a really good question. So I don't think there's any caregiver I've ever met who has no burden. I get to meet that person. So I think that it's okay to have burden, absolutely. It's okay to feel burdened occasionally. I think the tipper is when the burden is chronic, is constant, is daily, or it impacts your ability to carry out your role. So it's okay to feel burdened. I can't imagine anyone not at some point, but it's really about the magnitude and the impact. So usually it's caregivers for whom the burden has begun to prevent them from actually providing the care they need to or attending to their own needs that come to see me in my clinic. I'm sure if I were to talk one-on-one with every caregiver at Memorial Sloan Kettering Cancer Center, each caregiver would probably in their conversation, report burden, and if we were to administer one of our measures of burden, I'm sure burden would show up. But really, the fine line is that burden negatively impacting their ability to provide care for their loved one, fulfill their own roles, and take care of themselves? And so that's the differentiation point.
Okay, that makes sense. For the next question, is there any way someone can prepare for being a cancer caregiver?
Absolutely. I love this question. So I look at the type of work that I do using the word prehab. So I'm guessing that many of you on the phone know what the word rehab or rehabilitation is. So many people do rehabilitation after surgery, and they do physical therapy and occupational therapy, and they get themselves strong again. When I meet with caregivers for the first time, I actually conceptualize the work as prehabilitation, as let us strengthen all of the resources you already have, and let's find new ones. So what that means is identifying what your current strengths are, internal and external. So perhaps internally, you're a good problem solver, you're resilient, you ask questions, you're not afraid to ask for help, you take good care of yourself externally, you have a good social support network, you have a flexible job. But there may be other things that need work. So absolutely you can prepare. And the way you prepare is examining what are the current resources you have internally and externally, and where are there gaps. Are there more gaps internally or externally? Are the primary issues financial? Are the primary issues having to do with your social support network? And so examining all of these different factors is the best way to prepare. What you might find is that you're going to do fine. You have great resources if let's just say caregiving was going to be for a month. But what about if it was for 6 months or 2 years? Would those resources endure? So absolutely you can prepare, and the best way to do that is really to think through all the different things I shared this evening, to reflect on what resources you have and what resources you're going to need. And what that really takes is taking a very honest look at yourself and reflecting on your strengths and your weaknesses, your energy level, your own physical well-being. For example, how are you all doing physically? What are your own medical needs? And what are the challenges going to be for you? And I encourage any and all of you who are beginning the caregiving trajectory to speak with someone, a social worker if possible, or a psychologist or a psychiatrist or a nurse about this topic, because I really do believe that caregiving can be prepared for, and they are those caregivers who prepare themselves who are better able to weather the storm, are better able to do it long term, and they're better able to do it without significant negative impact on their medical and mental well-being.
Great. For the next question, the webinar attendee asks, would you please re-explain your caregiver-specific web-based study and what you hope to achieve with the study?
Absolutely. So I rushed through it. So the web-based study that I have with the American Cancer Society is actually based upon a therapy that we developed here at Memorial Sloan Kettering Cancer Center, a therapy that's called meaning-centered psychotherapy. It's an intervention that is actually an existential intervention, so it attends to the big existential questions that come up. And it was originally developed to help patients with advanced cancer at end of life cope with existential distress and spiritual well-being and coping with all the big questions that were coming up for them. And when I came to Sloan Kettering, I recognized that so many of the different topics, such as identity, responsibility, guilt, self-care, all of this was very pertinent to cancer caregivers, and have over the past, I'd say 3 or 4 years now, been conducting meaning-centered psychotherapy groups for caregivers here in person at the hospital. But knowing that only a very, very small sliver of the population actually gets to come to Sloan Kettering and receive services, the ACS and I have decided to create a web-based version of it, which is a series of webinars which involve some didactic or educational pieces, videos of therapeutic interactions, and then actually discussion boards with other caregivers who are involved in the therapy program. And what we're hoping to find is that the intervention helps caregivers to find a greater sense of meaning and purpose in the caregiving role. Certainly, as clearly mentioned over and again tonight, the caregiving role can lead to burden and stress and strain. But what I didn't focus on is the fact that the role can also lead to significant meaning and growth. And what I find in my clinical practice and here at Sloan Kettering in our research is that if we can help caregivers to hold on to some of the good that's come up, perhaps shifting priorities or an improved relationship with their loved one or improved care of oneself or recognition of one's strengths, for example, that can buffer caregiver burden. And so what we're hoping to do is foster and facilitate greater sense of meaning and purpose in caregiving. And the webinars are very brief. They're about 10 or 15 minutes long. Discussion boards are available. And if you're interested, please do not hesitate to call or email. And the research assistant here, Nicole, will be happy to get in touch with you and tell you more about the study.
Wow, well, thank you so much. It looks like that's all the time we have for questions for tonight, but I want to say thank you very much to Dr. Allison Allison Applebaum for speaking tonight. We're recording this webinar, so it will be available on the Beacon YouTube channel in the next 2 weeks. As you can see on your screen, we have another webinar coming up later this month about the Patient Survey Network, so please join us for that one as well. Thank you all very much. Have a great evening.